Good afternoon, everyone. My name is Jay Rebeck, and I'm the founder of Rebeck, a healthcare consultancy focused on improving outcomes and experiences using commissioning thinking. I'm obviously gutted not to be with you all in person today, but whilst COVID-19 had other plans for me and my family this week, I'm delighted to hear that the Rebeck team and the event organising committee are doing such great work delivering this year's showcase. And I'm equally delighted to be presenting you with a vision for the future of commissioning in Australia. Today, I'm going to pick up the gauntlet laid down by Professor Nick Goodwin this morning and describe a future world where strategic commissioning becomes a reality. My presentation is the first part of a double act that I'm doing with Matt Jones, the CEO of Murray OPHN, but more on that later. I'm joining you today from Camaragal Land in Sydney, and I would like to start by acknowledging the traditional owners of the lands that I join you from and pay my respects to elders past, present and emerging. I would also like to extend my respect and thanks to the many wonderful Aboriginal and Torres Strait Islander people participating in this year's showcase. And I'd also like to extend my respect to all Aboriginal and Torres Strait Islander people living in the communities that your PHNs serve. This session has three objectives relating to the three parts. In part one, I'll reflect on how PHNs can mainstream commissioning to drive sustainable change in health systems. In part two, Matt Jones will describe Murray PHN's framework for measuring and driving improved outcomes and experiences for the Murray region, and explain the broader applicability of this work nationally. And in part three, Neil Deacon from Rebeck will facilitate a discussion with you all about both these topics. In part one, I'm going to explore the future of commissioning in Australia. So let's get into it. When PHNs look back at the commissioning mountain that they've climbed since 2015 and before, it's clear that PHNs have come a very long way. You can see evidence of this simply by listening to the quality of the PHN presentations that you've been hearing over the last 2 days. Since 2015, the role of PHNs has grown substantially in areas such as mental health, alcohol and other drugs, aged care and palliative care. And furthermore, PHNs have played an increasingly pivotal role supporting Australia's primary healthcare emergency responses to bushfires, floods, droughts and the COVID-19 pandemic most recently. It's fair to say that since the inception of PHNs in 2015, PHNs have grown into confident regional commissioners that strengthen primary healthcare and improve system integration. But whilst PHNs have proven that commissioning works and have impressive achievements to point towards, you also know that the health challenges facing your populations are likely to increase. The burden of illness has changed with people living longer with more chronic diseases. We're also seeing increasing impacts of climate change, increasing urbanisation, and the increasing prevalence of infectious diseases. As PHNs, you know that there is so much more that can be done and needs to be done to improve the health of the populations that you serve. In this session, I'm going to first introduce you to Sally, and then I'm going to explain how PHNs can mainstream commissioning to improve the life outcomes and experiences for people like Sally. So let me introduce you to Sally. When I talk about Sally, I'm really talking about an example of the type of person who could live in your region. As you can see in this diagram, Sally has faced a series of significant challenges throughout her life, including low birth weights, learning difficulties at school, insecure work, poor mental health, and chronic disease. There are a myriad of reasons for this, including intergenerational trauma and systemic racism, to name but a few. But the real tragedy of Sally's life is that at every single one of those 10 steps throughout Sally's life course, the system has missed opportunities to help Sally get onto a better life course trajectory. So this raises a question. What can PHNs do to help Sally and other people like Sally get onto a better life course trajectory? My thesis in this presentation today is that PHNs need to help mainstream commissioning. Since 2015, PHNs have been the only segment of the Australian health system that has committed wholeheartedly to investing taxpayer money through an outcomes-focused and evidence-based commissioning model. Whilst I would argue that PHNs have emphatically proven the value of commissioning, PHN commissioning has felt a bit like a niche sport for the adventurous few. And whilst I've loved climbing the metaphorical commissioning mountain with you, I think the PHN movement needs to make the case for Australia to mainstream commissioning. I feel like we've started to reach level ground and we can try something a bit easier and a bit more popular, a bit like walking. Because ultimately, even if PHNs become the greatest commissioners on the planet, your funding is only a small fraction of the total health investment being made in Australian health systems. So let me explain what I mean by mainstreaming commissioning in a bit more detail. PHNs successfully commission a range of services centred around primary healthcare. In simplified terms, the Australian system is at stage 1 on this diagram, on the left-hand side. If we could encourage other parts of the healthcare system to adopt a commissioning model, we could get to stage 2. If all of the investments in health promotion, disease prevention, primary care, residential care, acute care and specialist care went through the same commissioning model, just imagine the possibilities to improve outcomes and experiences for people like Sally. And stage 2 is not a fictional scenario. REBEC are currently working with the Department of Health in Manitoba, Canada, to implement an approach where every dollar of health investment in the province will flow through a commissioning and accountability model. But let's take it one step further to stage 3. Now imagine if all other parts of the Australian government were also to adopt the same commissioning approach. Again, stage 3 is also not a fictional scenario. Indeed, the New South Wales Department of Communities and Justice and the Victorian Transport Accident Commission are just 2 examples of other government agencies that are already embracing a commissioning model. So now let me explain the 6 dimensions of my future vision for strategic commissioning. Firstly, let's look at needs assessments. We currently have a fragmented diaspora of needs assessments within every PHN region across Australia. With so much fragmentation and overlap of different needs assessments from different organisations, it's hardly surprising that this leads to fragmented planning and fragmented care. Imagine a future where there was a single joint strategic needs assessment that was coterminous with the geographic boundary of every PHN. Again, this is not fiction. The UK has been doing exactly that for 30 years, with joint strategic needs assessments the norm across every region. Secondly, rather than every organisation in your region having their own strategic plan, what if there was a single interagency strategy for improving all the outcomes and experiences for your population? The mental health and AOD plans that have been led by all PHNs in Australia have demonstrated the benefits of this joined up approach to planning. But imagine if all your work was planned like that. Thirdly, imagine the leaders of all the agencies in your region across healthcare, aged care, social care, education, justice, housing, police and emergency services regularly coming together to discuss how best to improve the outcomes and experiences for people in your region. Only rather than waiting for a bushfire, flood or a pandemic before convening this group, as is the case now, what if they were to meet regularly and proactively? Fourthly, imagine the benefits if investments improving population outcomes and experiences could be made seamlessly across government boundaries through a co-commissioning approach, as happens in the Canterbury Health System in New Zealand. Fifthly, imagine the insights that could be gleaned if all the population health data in your region was pulled into a central place and linked up with other cross-government data. Analysts could use information about the social determinants of health to identify cohorts of people in your region who are at risk of developing illnesses like diabetes and wrap coordinated support around those people to prevent them getting sick in the first place. Preventative intervention would keep people healthy while saving expensive hospital treatment down the track. This is exactly the approach described by South West Sydney PHN yesterday, when they described how My Care Partners are using the hospital admission risk prediction HARP tool to identify patients with complex and chronic conditions and improve their care coordination to reduce potentially avoidable hospitalisation. Clearly, there are huge opportunities to better exploit and link data using the PHN Primary Health Insights platform, which is obviously an exciting frontier. And finally, let's look at the 6th dimension. Imagine if there was a consistent set of outcomes and experiences that was measured by all providers across health and social care. This is what the NHS currently has in place with the NHS Outcomes Framework, where all health and social care data is stored and analysed by NHS Digital. And when we look at results-based accountability in New Zealand, this consistent approach to measuring outcomes has been taken further to include all commissioned services across government. So if all this was in place, what would it mean for Sally? If you had a joined up interagency commissioning response in your region, you would be able to seize opportunities to improve outcomes and experiences at every step in Sally's life course. A mature strategic commissioning system would have the intelligence, leadership and foresight to put in place the right interventions to help get Sally onto a better life trajectory at every step across the course of Sally's life. Now, when I talk about how joined up working across government agencies can simultaneously improve health outcomes and social determinants, I am of course acutely aware that I'm preaching to the choir. And the reason I know that is because there are so many brilliant examples of strategic commissioning that I see in action in PHNs, many of which have been on display at this year's showcase. Looking at the presentations by PHNs over the last few days, I can see so many examples where PHNs are proactively moving towards this strategic commissioning approach. I've shown a few examples here, and I've shown how these initiatives would better help people like Sally get onto a better life course trajectory. It's great to see so many excellent examples of innovative commissioning across the social determinants. These include how Murray PHN are enhancing paediatrics in primary care, how Brisbane South PHN are actually delivering a community impact initiative for the South Moreton Bay Island community, how Went West are introducing social prescribing, and 2 alcohol and other drug co-commissioning initiatives at Cordnair and Central and Eastern Sydney PHN. And finally, building awareness around domestic and family violence in primary healthcare. As PHNs, you're already forging stronger relationships with other parts of healthcare and across government to improve health and the social determinants of health for people living in your region. So let me summarise the key takeaways from my talk. Today, I've explained 6 dimensions of a mature strategic commissioning system and 6 strategic activities for PHNs to help advance strategic commissioning in Australia. PHNs are already moving towards this vision, and hopefully this talk has given greater clarity about the future of strategic commissioning and the road ahead. If PHNs could help achieve this vision, imagine the positive impact it would have on the life course trajectory of individuals like Sally and populations like the people who live in your region. Before I wrap up, I firstly want to say that I hope everyone at the showcase has had a great experience, and I really look forward to seeing as many of you as possible between now and the next showcase. And finally, I want to explain how the next talk by Murray PHN's CEO Matt Jones picks up the story. The 6th dimension of strategic commissioning looks at how to measure and drive outcomes and experiences for populations. At REVIC, we've had the great privilege of working with Matt Jones, Belinda O'Sullivan and the wider team from Murray PHN over the past year. And I'm delighted now to hand over to Matt, who's going to discuss how Murray PHN have been advancing the 6th dimension through the development of the Murray PHN Outcomes and Experiences Framework. Over to you, Matt.